Hello everyone, my name is Owen Lowe and I am a PhD student within the School of Computing at Edinburgh Napier University. The main purpose of this video is to demonstrate some of the functionalities within the eHealth Cloud platform. I will begin by showcasing the authentication and authorization system provided by Spock. The feeding of patient data to our eHealth Cloud platform will then be demonstrated via a patient simulator. Finally, reading of simulated patient data using a patient monitoring application will be showcased. So with the introduction over, let's have a look at the first demonstration of this video, which is the Spock authentication and authorization system. In essence, Spock provides a highly secure and sophisticated login-in system for users to access services provided by the eHealth Cloud platform. Using what we refer to as a policy syntax, users are classified under specific roles and groups. For example, a role may be a nurse, whilst she may fall under the group medical staff. So, what we have here in this notepad is two users who were created previously for demonstration purposes. The first user, Bill Buchanan, his role is a professor and he falls under the group Napier staff. The second user is Fiona Shepherd and her role is a nurse and she falls under the group medical staff. Now, our current policy syntax for the eHealth Cloud platform states that any user which falls under the group medical staff can have access to our services provided by the eHealth platform. Users who fall under any other group will be rejected during the login-in process. To demonstrate Spock's authentication and authorization process, I'm going to be using this example application here named Spock, which is basically the login-in system which we use for all the eHealth services. To begin with, if we attempt to log in as Fiona Shepherd with her credentials, we should find that she is both authenticated and authorized to use the example service behind this login-in system here. The reason for that is because our policy syntax states that medical staff are authorized to use this service. Now, if we attempt to log in as Bill Buchanan, we should find that authentication is successful, but authorization failed. What this basically means is that Spock is saying the credentials you have provided for Bill Buchanan are totally valid, however, you're not authorized to access the service. And the reason for that is because Bill falls under the group Napier staff. And our policy syntax currently forbids anyone who's not part of the group medical staff to access the eHealth service. The second demonstration in this video will showcase the feeding of patient data to the data buckets, which are managed by the eHealth platform. To achieve this goal, we will be using a patient simulator software, which I've been working on as part of my research here at Napier. So what we have here is the front end of the patient simulator, and under this tab we have a list of virtual patients which have been created in the past. I've selected the virtual patient Alice Wonder and this is her details here. I'm not going to go into the technical details of the patient simulator for this video. What I will state is that the main purpose of the patient simulator is to simulate the 5 physiophysiological signs of a patient, which include heart rate, blood pressure, temperature, respiratory rate, and oxygen levels. So to begin the simulation of patient data, we first have to choose a start and stop time. In this case, I've simply chosen to simulate 1 minute of patient data. once the simulation starts, the simulated data is automatically uploaded to the data buckets held within our eHealth Cloud platform. Unfortunately, because interaction between the patient simulator and the data buckets occur in the background code, there's not much activity we can capture in terms of the data being uploaded. However, in the third and final demonstration, I'll run the patient simulator side by side with a piece of software which is capable of reading patient data to demonstrate the last part of this video, the reading of patient data from the data buckets. In the third and final part of this video, I'll demonstrate the reading of patient data held on our data buckets. What we have over here is a small application I've developed named the Patient Monitoring System. The basic idea is that you simply select one of the virtual patients whose data is stored within the data buckets, and their current phytophysiological sign data will be read at specific time intervals. Based on the numeric value of each phytosign data read, a risk rating is produced by the patient monitoring system. The risk assessment system is based on what is known as the early warning score system. And in essence, the higher the value, the greater there is a risk for the patient. Okay, to give a demonstration of the reading of patient data, we first have to simulate some patient data to be uploaded to the data buckets, which is occurring over here with the patient simulator. If we now begin to monitor the phytophysiological sign data of Alice Wonder, the person or the patient who we are currently simulating, we can see over here that a risk rating of 0 is detected. And the reason for that is because our heart rate, blood pressure, temperature are at relatively normal values at this point in time. If, for example, we were to increment the heart rate, which I'll do now, we should find that the patient monitoring system, upon reading this new heart rate value, will produce a risk rating of 3, and it states here a minor risk is detected. If we further increment phytophysiological signs of a patient, for example the blood temperature, we can see the text now changes to red because we've generated a risk rating of 6, which is significantly higher than before. So that brings an end to this video demonstration. I hope you found it useful, and thank you for listening. Goodbye.